Hi, my name is Jessica Kersey, and I'll be talking today about the maternal mortality rates among Black women in America. Black women are more likely to die from pregnancy-related complications in birth than white women in the United States. In 2016, 12.7 white women died per every 100,000 live births, compared to 43.5 deaths per 100,000 live births for Black women. We do not know what the exact cause is for this racial disparity, but we have found that poverty is a major contributing factor to these mortality rates. This health issue is ongoing and the population is continuously impacted. However, the overall impact has decreased over time with better prenatal care, meaning that the overall number of women who have died from pregnancy complications has decreased, but Black women still have a significantly higher risk of dying from prenatal complications. We can apply the socioeconomic model to this health issue, and we can find what hinders and helps this public health issue on each individual level of the model. On the individual level, women just not knowing their risk hinders this public health issue, meaning that women do not know that they are more at risk for having pregnancy complications that can lead to death. But women advocating for themselves and asking what their risks are helps this public health issue, because they can then become aware and know what signs to look out for. On the interpersonal level, family pressures and expectations to have a baby hinders the issue. This is because women are pressured and felt pressured to have a baby before they're ready and before they know what their risks are. But perspectives of friends and families to be more prepared for motherhood helps this public health issue, because this helps to empower women to find out what their risks are and what they need to be looking out for before, during, and after pregnancy. On the organizational level, discrimination and racism hinders this public health issue. We don't like to think that there is still discrimination and racism, but there is, and many times women have felt like they have been discriminated against at the doctor's office and not taken seriously, and this leads them to not trust their physicians. Healthcare providers giving unbiased medical advice will help the issue. This means that healthcare providers can lay out what the risks are despite the woman's race or anything else, and just look out for the woman's best interest overall. On the community level, members of the community and population at risk do not share their stories to raise awareness. That hinders the issue, because we need to raise awareness and educate each other and our community. This leads to spreading awareness for the issue, which helps this public health issue. The more we know, the more we can do. So if women know their risks, then they can better prepare to avoid having complications that lead to death. On the policy level, the lack of education, again, not knowing, hinders this public health issue. If we don't know what the cause is and if we don't know what the issue is, then we don't know how to avoid it. The CDC's pregnancy mortality surveillance system helps this public health issue, because it outlines all the different causes of pregnancy-related deaths for Black and white women over time, so that we can eventually identify what the overall cause is. The evidence-based interventions to encourage women to stop smoking during and after pregnancy. If women who live in low socioeconomic areas are smoking, this can lead to more issues over time, and eventually, such as deep vein thrombosis, heart attacks, pulmonary embolisms, and things like that. So smoking further increases their risk of having complications. The expansion of Medicaid enrollment for pregnant women. Both Washington State and Tennessee did this for pregnant women overall, and their pregnancy-related deaths had decreased just by having women in the doctor's office more often to have more prenatal screenings done more routinely. So they were able to find complications and maintain complications over time. This leads to more prenatal screenings There's ample evidence around the world that shows that more prenatal screenings helps to avoid pregnancy complications. This does not mean that there's not going to be pregnancy complications, but when they do arise, they are found quickly and they're able to be dealt with before they lead to death. The evaluation would be for smoking, the number of women who smoked before versus after the intervention, the number of Black women enrolled in Medicaid before versus after the intervention, and the number of prenatal visits for Black women. So a decrease in the number of women smoking and an increase in the number of prenatal visits for Black women is how we would evaluate these interventions. We know if the interventions are a success or not based on the number of Black women who died due to pregnancy-related complications. So if it was a success, then we will see a decrease in the maternal mortality rate for Black women. And of course, that's what we're looking for. That's our overall goal, is as a health educator to educate the public and then be able to find out why this is happening, educate people on why it's happening, and be able to decrease the number of Black women who are dying. Potential barriers are going to be honesty with self-reporting. So this is self-reporting with especially smoking. We want to make sure that the women who say that they have stopped smoking have stopped smoking. We also want to make sure that we have all proper consent to avoid HIPAA violations. So being able to get medical records requires proper consent from physicians and patients. And we want to have accurate baseline data and physician cooperation. So we want to know how many women smoked before that intervention. We want to know how many women used Medicaid before the second intervention. And we also want to know how many women or how many prenatal screenings each woman was recommended to have before the intervention. This is the logic model for the proposed interventions. So the inputs, we will need healthcare workers with prenatal experience. Again, we don't want to have people without prenatal care experience dealing with our pregnant women. We want to make sure they have the best care possible. Patients willing to participate in the intervention, informational resources distributed, health educators, facilities for screenings, and funding for educational material and research. So we need research materials, we need educational materials, and we need funding for those things. Activities are policymakers ensuring that insurance companies will pay for more prenatal screenings, research on causes of death related to pregnancy, education on the patients, or education for the patients of the importance of the screening, educations on the physicians on the importance of the screenings, and then accountability for both. So we want to make sure that everybody involved is educated on why we're doing what we're doing, what our overall goal is, and accountability, and make sure that we also have policymakers helping us get funding for these things. The outputs are the number of Black women were recommended, the number of Black women were recommended to have more screenings, the number of Black women who had pregnancy complications that were maintained. This means that the complication did not lead to death and it was maintained over time. The information on complications from pregnancy and childbirth in Black women, compliance in prenatal screenings for Black women. So we want to make sure that we know how many women benefited from this, from the different interventions, and the compliance in more prenatal screenings. The outcomes are the number of women who died from complications. We also want to make sure that we find knowledge on trends related to death in pregnancy in Black women who survive pregnancy complications. And we also want to know if there was a reduction in maternal mortality. Our impacts would be an increase in the recommended number of prenatal visits for Black women, information on the causes of increased death rates after childbirth in Black women, and a decrease in mortality rates in Black women. So we want to make an impact. We want to know why the issue is an issue and how we have fixed it and how we've impacted it. Thank you so much for your time. You have a great day.